Okay, can you guys see my screen now?
Yes.
Yes.
Okay, so I think we should start today's lesson. Okay, so today we're going to be doing pharmacology, and before we start, I would like to say something. So basically, pharmacology is one of the easiest subjects in krok. So in these lessons, if you pay attention and then take notes of the points I say you should take note of, jot it down and try to memorize the points I tell you. So I'm 100% certain you're going to get every pharmacology question you see in krok correctly. So please, guys, just pay attention and focus. Okay. So for the first part, we're going to be dealing with definition of basic terminologies in pharmacology. So the first terminology is pharmacodynamics. So this simply means what does drug does to the body. So when you take a drug, what does the drug do to your body? So for example, you take paracetamol and it cures your headache. So please memorize this pharmacodynamics, what the drug does to the body. So the next term is pharmacokinetics. So pharmacokinetics talks about what the body does to the drug. So this talks about absorption, bioavailability, route of elimination. So when you take the drug, what does the body do to the drug? So take note of these two terms, pharmacodynamics and pharmacokinetics. So dynamics, what the drug does to the body, and kinetic, what the body does to the drug. Please take note, it's very important. So moving on, we're going to receptor. So basically, receptor is a target molecule in your body that the drug binds to. So when you take a drug, it's going to seek a target molecule and it's going to bind to it. So it's going to form a drug receptor complex. So when drugs interact with receptor, it includes three forms. So it interacts in three ways. So it can either be an agonist or antagonist or both. So it can be agonist, antagonist, or agonist and antagonist at the same time. So agonist simply means positive, while antagonist means negative, while agonist and antagonist means both positive and negative at the same time. So agonist is a drug which stimulates the receptor, so it increases the effect, while antagonist inhibits the receptor, while agonist and antagonist stimulate one subtype of receptor but blocks another one. Okay, so the next terms are combined action of drugs. So this is when you take one or more drugs. So what is going to be the effect? So synergism is when one drug strengthens the effect of another drug. Synergism, when one drug strengthens the effect of another drugs. So we can see this 1 plus 1 equals to 3. So when drug A and drug B gives a greater effect than when you take them separately. So the next term we should take note of is potentiation. So potentiation is when one drug increases the effect of another drug. So one drug increases the bioavailability of another drug. So basically it increases the level of drug A in the blood. Then the next term is antagonism. So this is like inhibits. So it weakens the effect. Instead of stimulates, it inhibits. So remember, antagonism has a negative effect. Okay, so next terms are effect of repeated dose of drugs. Please take note of this point, it's very important. So accumulation, so the is the accumulation of a drug or its effect. So take note of the two types of accumulation, material and functional. So material accumulation of digitoxin or there's functional accumulation of antidepressants. So this is a krok question, so you might see it in your krok. So take note. So material accumulation occurs with digitoxin, while functional accumulation occurs with antidepressants. Tolerance. So tolerance is a decrease of the drug's action after its repeated administration. So for example, every time you have abdominal pains or every time you have period pains, you take diclofenac or you take paracetamol. So after some time, the paracetamol is going to have a reduced effect because your body has gotten used to it. So this is tolerance. So take note of the difference in tolerance and tachyphylaxis. So tachyphylaxis is a rapid form of tolerance that develops during the first day of treatment. So the main difference between tolerance and tachyphylaxis is the time. So tolerance takes days, weeks, or months, but tachyphylaxis is very, very quick. So it takes minutes, hours, or within a day. So take note of the difference in tachyphylaxis and tolerance. So also take note of the drugs that are associated with tolerance and tachyphylaxis. So for tachyphylaxis, Croc is going to tell you ephedrine. Ephedrine, when you take ephedrine, you might develop tachyphylaxis. Then when you take nitroglycerin for angina, which is chest pain, you might develop tolerance. Okay. So the next term is drug dependence. So it is an irresistible urge to take a drugs. So there are two types, physical dependence and psychological dependence. So physical occurs when you have a drug to alter your general state or moods. So for example, maybe you have pain in your hand and you need to take the drugs to take the pain away. So this is physical dependence. But psychological dependence, there's nothing wrong with you physically. You just want to take the drugs to make you feel better. That's psychological dependence. So take note of the difference in physical and psychological, and also take note of the difference in tolerance and tachyphylaxis. So the next one is abstinence. So the physical effects that result from depriving an addict of the drug to which he or she is habituated. So for example, if someone is addicted to opioids and you take the person from an environment where he can get opioids, so after some time the person is going to get physical symptoms. For example, maybe tremors, his hands are going to be shaking, or headache or sweating. So he's going to be having withdrawal symptoms from opioids. So this is abstinence. So when you abstain for a drug for a particular amount of time, you're going to have withdrawal symptoms. So is everybody following what I'm saying? Am I speaking too fast? Should I slow down?
Maybe
Yes,
a
please
little bit.
slow down a little
But
bit.
it's okay.
No, no, continue.
Okay. So that's all for the first part. So now we're going to have questions. So please, anybody should read and answer the questions. Please don't be shy. Let's try to be fast. Anyone read and answer?
Continuous taking of drug results in reduction of its efficiency. This phenomenon is called um, tolerance. Or
Yes, that's
a
correct. Why isn't the answer tachyphylaxis?
from what you said, tachyphylaxis is like immediately
Yes,
a
that's
minute, while tolerance like very long time.
yes, that's correct. Good job. Question two. Anybody please read and answer. Is that up?
If patient
Mm-hmm.
has been taking isoscorbate for stenocardia prevention for quite a long time. Now he knows a significant decrease in the effect of the drug. What is this phenomenon called? Should be tolerance, I'm not wrong.
Yes, that's correct. Okay, next question. Someone else, please.
Okay, drug addicts upon termination of action. A drug have heavy physical, neurological, and somatic violation. What is the name of this symptom complex? So it's abstinence syndrome.
Yes, that's correct. Good job. Next question. Okay, someone read an answer, please.
A patient who has been suffering from cardiac insufficiency for several months has been taking digoxin and on an outpatient basis. At a certain stage of treatment, there appeared symptoms of drug overdose. What phenomenon underlies the development of this complication? Overdose. Um,
Material.
Material accumulation. Material accumulation.
I think it should be it
Material
between
accumulation.
functional and material accumulation.
So which one do you think the answer is?
Material.
Material.
Okay, so you said material. So let's review our book. So yeah, we talked about material accumulation happening for digitoxin. So and the question talks about digitoxin. Yes, it's material. So I
Okay.
want to explain the difference between material and functional. So for material accumulation, the drug is still in your system, the drug has is still in your system. But for functional accumulation, you can still see symptoms after the drug has left your system. So for example, when you take alcohol, even after you finish excreting all the alcohol, you might still feel drunk. You might still have symptoms of drunkenness. So that's the difference between functional accumulation and material. So for functional, you might still feel symptoms after the drug has left your system, but for material, the drug is still in your system when you feel symptoms. Do you guys understand the difference?
Yes.
Okay, moving on to the next question. Please read an answer. Guys, someone read an answer. Can you guys hear me? Hello?
Yes. A patient taking clonidine for essential hypertension treatment was using alcohol that caused intense inhibition of central nervous system. What may it be connected with? Mm, is it idiosyncrasy?
Oh, no, try again.
Um, okay. Intoxication?
No, try again. Okay, so I want you to like try to understand the question. So the person
Okay.
takes clonidine for hypertension normally, then he now
Mm.
took alcohol that increased the effect of clonidine. So it's like,
Oh, that's potentiating effect.
yes,
One.
exactly, that's
Oh,
correct. Okay, good job. Okay, so let's try to, so idiosyncrasy, this question number three, idiosyncrasy. So this means when the mechanism of action is unknown. So unknown, if unknown cause is what we call idiosyncrasy. Yeah. Okay, so next question. Anyone please read an answer. Guys, nobody wants to read. Hello
at
there.
poisoning by fossil organic compound, an atropine sulfate was used. What phenomenon is underlaid in antiductal action? Is it antagonism? A.
Yes, that's correct. Okay, answer the next question, please.
What is the name of the phenomenon when at the prolonged using of manipulation efficiency goes down? It will be adaptation because
Yes, that's correct.
prolonged.
So please take note. Another name for tolerance is adaptation or habituation. So take note of the three names because krok can use any of them: tolerance, habituation, or adaptation. Okay, so that's the end of the question section. So we're moving on to the next topic. So please take note. This part is very tricky, so you have to pay a lot of attention. So the next topic is called cholinergic drugs, parasympathomimetics, or cholinomimetics. So I want you to take note. These drugs work on the parasympathetic system. So what does the parasympathetic system do? It's rest and digest. So it slows down and make sure you digest your food properly. Okay. So first we're going to talk about the central nervous system. So the peripheral nervous system is divided into the autonomic and the somatic. So the autonomic responsible for the visceral functions like cardiac outputs, digestion, while the somatic is responsible for movement, respiration, skeletal muscles control. Okay, moving on. Okay, so the autonomic nervous system has two parts, the sympathetic and parasympathetic. So cholinergic drug is going to be acting on the parasympathetic part, which is the rest and digest. So I want you to take a look at this diagram. So we're going to be acting on this first part, the parasympathetic. Okay, so we're going to be acting on this nerve ganglion, the parasympathetic. So this is what we're going to be acting on. So its effect is going to be on cardiac and smooth muscles and gland cells. So now we're going to look at the nerve terminal of cholinergic drugs. So we can see here from the preganglionic fiber, acetylcholine is released and it interacts with the receptors. Acetylcholine is the main neurotransmitter for the presympathetic ganglion. And I want you to take note of this ACHE. So it's an abbreviation and the full word is acetylcholine esterase. What's the function of this? So the function of this is to break down acetylcholine into acetate and choline, and then it is reabsorbed back into the presynaptic ganglion. So take note of this, is very important. Acetylcholine esterase, because we're going to talk about some drugs that are going to act on acetylcholine esterase. So basically, choline plus acetyl-CoA forms acetylcholine. Then acetylcholine is released by vesicle into the synaptic cleft. So acetylcholine is going to come into the synaptic cleft and act on the receptors. And when it is done acting on the receptors, it is broken down by acetylcholine esterase, so it can be recycled and used again. So please take note. Okay, so now we're going to talk about the receptors acetylcholine works on. So it works on three main receptors, M1, M2, and M3. So a mnemonic I used to remember the location of these receptors is head, shoulders, and everything else. So M1 works on the head, while M2 is found in the heart, while M3 is found everywhere else, the GI system, the blood vessels. So take note of the location. So M1 receptors is found in the CNS, so the nerve cells, the ganglia, the head, while M2 is found in the heart, while M3 is found in the GI or the glands or the blood vessels. Please take note. Okay. So here we can also see the location. So M3 receptors is found on the glands, M3 is found in the smooth vessels, and M1 is found in the CNS. So now we're going to look at the location again. So M1 is found in the CNS and the gastric parietal cells. Please take note of this, the location. If you want to take a picture, take a picture. It's very important. So M1 is found in the CNS or in the gastric parietal cells. M2 is found in the heart, while M3 is found in the exocrine glands, the smooth muscles, or the vascular endothelium. We also have M4 and M5, which is also found in the CNS. Okay, so now we're going to talk about the other type of receptors. So we have two receptors that deals with cholinergic drugs. So we have the muscarinic receptors and we have the nicotinic receptors. So I want to refresh your brain by going back to this diagram. So here we can see this. So this is the muscarinic receptors and this is the nicotinic receptors. So the nicotinic receptor deals with skeletal muscles. So these are the receptors of the cholinergic system, the muscarinic and the nicotinic. So now we just finished talking about the muscarinic receptors, which is the main one are M1, M2, M3. M1 is found in the CNS or the parietal cells, M2 the heart, M3 is everywhere else. So my mnemonic I use is head, heart, or head, chest, and everywhere else. So just try to remember that for the M1 receptors location. Then the next one are the nicotinic receptors, which is the NM cholinesterase or the NN cholinesterase. So NM is a short form for neuromuscular. So this is located between the neuro and the muscular junction. So it's between the neuro and the muscular, so between the neuron and the skeletal muscles. So its function is depolarization of muscles for contraction of skeletal muscles. So the next one is the NN cholinesterase. So it's found in the autonomic ganglia. So depolarization of postganglionic membrane in the adrenal medulla for catecholamine release. So let's go back to the picture so we can see what they're talking about. So this is the NN receptor here. Can you guys see the mouse on where I'm pointing?
Yes.
Yes.
Okay, so this is the NN receptor. So it works between the neuron. So this is the neuron and the skeletal muscle. So it works here, right here. Then this is the NM. So it works in the adrenal glands. So here. Okay. So now we're going to the moving on to the drugs. So when we're talking about the cholinergic drugs, we have three effects or three types of drug. So we have the direct acting drug, the indirect acting drugs. Okay, so for the direct acting drugs, we're going to be talking about the choline esters, and the main one is acetylcholine. Then we have pilocarpine, betanicol, and the stimulants of the N receptors are nicotine and lobelin. So I want you to pay attention to this. This is a popular crop question. Lobelin. Lobelin is used for restoration of breath. Write it down. It's a crop question. Lobelin is used for restoration of breath. So the first drug we're going to talk about is pilocarpine. Now, pilocarpine is applied to the eyes and it causes miosis. Miosis. And some of the side effects are sweating and salivation. So pilocarpine is applied to the eyes. So it can be used for glaucoma. It can be used for glaucoma. What is meiosis? Can anyone tell me the definition of meiosis? Anyone, please just try to answer. Guys, meiosis. It's easy. What's the definition of meiosis?
Only the pupil shrinkage.
Yes, so it's constriction of the pupils. So the pupils become small. Okay, so that's the effect of pilocarpine. So it can be used in open angle glaucoma and also for examination of the eye by ophthalmologists. Okay, guys, am I too fast?
Yeah.
No? Okay. Okay, so now we talked about the direct acting drugs. So we have the acetylcholine, the pilocarpine, and the lobelin. Lobelin is used for restoration of breath. So next we're going to move on to a different category, which is the indirect acting drug. So remember I told you about anticholine, acetylcholine esterase. So let's go back to the diagram to refresh your memory. So this is acetylcholine esterase. So it's found in the synaptic cleft, and its job is to break down acetylcholine so it can be reused. So after acetylcholine is done dealing with the receptors, so it is broken down so it can be reused. So now we have a drug acting on acetylcholine esterase. So please remember the name acetylcholine esterase. So the drugs are called indirect acting cholinergic drugs. So it is called anticholine esterase drugs. So the main drugs here are physostigmine, donezepil, rivastigmine. So the mnemonic for this is the means. So just remember MINE. So whenever you see this MINE, just know that it is an anticholine esterase drugs. So take note of the difference. Galantamine, physostigmine, neostigmine. So another name is proserine. So krok can use proserine instead of neostigmine. So just remember the means. So these are anticholine esterase drugs. So it prevents the breakdown of acetylcholine in the synaptic cleft. So the drugs are going to block this. So it's going to block acetylcholine esterase. So it's going to prevent the breakdown. So there's going to be excess of acetylcholine in the synaptic cleft. You guys understand?
Yes.
Okay.
Yeah.
So, uses for anticholinesterase drugs. So they are used in glaucoma. So pilocarpine is used in glaucoma, and then myasthenia gravis. So myasthenia gravis, the main symptom is weak muscles. So we are going to need something to increase skeletal contraction. So we are going to use the indirect cholinergic drugs. So the anti-acetylcholinesterase drugs. So the galantamine, the neostigmine, physostigmine, peristigmine. So you see they all end in MINE. So take note, this is the key for remembering them. So they are the means. So the galantamine, neostigmine, physostigmine. Also they can be used in Alzheimer's, and also they can be used in post-operative paralytic ileus. So after operation, some patients find it difficult to pass feces or urine. So these drugs are going to help you to pass feces and urine. Okay. Okay, so moving on, we have organophosphate poisoning. So when you take excess of these drugs of acetylcholine, so you are going to get these symptoms. So you're going to get increased saliva, increased tear production, diarrhea, vomiting, small pupils, sweating, muscle tremor, and confusion. And the mnemonic to remember this is dumb bell. So I want you to take note. These are the effects of cholinergic drugs. So everything you see here is the effect of cholinergic drugs. So please take a picture, write it down. Just make sure you know this. So once you know this, you're going to know the effect of cholinergic drugs. So it's used for diaphoresis, sweating, urination. So when that is why they said it's used for post-operative paralytic ileus or urinary retention. So if your patient comes to you and is unable to urinate for like 5 days, so you are going to give him a cholinergic drug to help him urinate. Or for meiosis. So meiosis causes pinpoint pupil. So this can be used in glaucoma because cholinergic drug increases aqueous humor excretion. So it's going to help to alleviate the symptoms of glaucoma. Also, it can be used for ophthalmologic eye exam because it's going to make the pupil very small so you can examine the entire eyeball. Also, it causes bradycardia. So I just want you to clinically, so if patient comes with the tachycardia, so you can give a cholinergic drug, so it's going to slow down the heart rates. So it can cause bradycardia. Also, bronchospasm. So this is dangerous when you use it with asthmatic patients because if it causes bronchospasm in asthmatic patients, it's going to be very dangerous. Also, it causes bronchosecretion increase, MS vomiting, lacrimation, and loose stool. So whatever you do, make sure you memorize this. Dumb bell. So this is the effect of cholinergic drugs. So if you know the effect of these, you're going to know what the cholinergic drugs do. So it's very important. So this is a very popular core question. Take note of it, memorize it. Whatever you do, don't forget. So organophosphate poisoning, krok is going to use the word organophosphate poisoning, or Amanita muscaria, or mushroom poisoning, or when you ingest insecticide. So this is a popular krok marker, mushroom poisoning or organophosphate. And when you get poisoned by organophosphate, so these are going to be the symptoms: dumb bell. And the treatment for organophosphate poisoning is atropine. So this is the treatment for organophosphate poisoning, atropine. And what is the mechanism of action is antagonism. So atropine is going to block the effect of acetylcholine. Also pralidoxome. So pralidoxome works in the CNS, while atropine works everywhere else. So take note of the treatment of organophosphate poisoning: atropine and pralidoxome. Okay, so moving on, we're going to have anticholinergic drugs, ganglion blocking agents, or neuromuscular blocking agents. So we just talked, these are the effects of cholinergic drugs. So anticholinergic drugs are going to have the opposite of these effects. So take note, it's very easy to know this type of things. So anticholinergic drugs are going to have the opposite of this effect. So if you remember the mnemonic of dumbbell for cholinergic effect, you just think of the opposite, and that's what anticholinergic drugs are going to do. Okay? Okay, so the most popular anticholinergic drugs you just have to know is atropine. So atropine is the most popular anticholinergic drugs, and this is how it works. So atropine is going to block the cholinereceptor, and when it blocks the cholinereceptor here, so acetylcholine cannot work on the receptor. So it's going to inhibit the effect of acetylcholine. So atropine is going to inhibit the effect of acetylcholine. Okay, so this is Atropa belladonna. So this is another popular question. We're going to talk about it later. Okay. So action of atropine. So atropine has an overall stimulant action. So atropine stimulates the medulla centers by blocking the cholinergic. Not important. Okay, so in the central cardiovascular system, atropine causes tachycardia. Remember, we talked that cholinergic drugs causes bradycardia. So this is the opposite. So atropine is going to cause tachycardia, and also in the eye, so it's going to cause mydriasis. So who can tell me what's the definition of mydriasis? Anyone, please, very fast. Guys, mydriasis. What's the definition of mydriasis?
And I think dilation of pupil muscles.
Yes, that's correct. Addresses the dilation of the pupil. And I want you to take notes. This is a very important point. So, atropine is going to increase intraocular pressure and also increase aqueous humor production. So, never ever give atropine for people with glaucoma. Take notes. Don't ever give atropine for people with glaucoma. Okay. So, now we're going to talk about atropine overdose. So, now I want you to think about the opposites of dumbbell. So the opposite of dumbbell is going to be atropine overdose. So instead of excess salivation, we're going to have dry mouth. So we're going to have difficulty in swallowing, hot skin, difficulty micturition. So micturition is urination. So we're going to have difficulty urinating. Also, we're going to have dilated pupils, and we're going to have excitement, which is like tachycardia, also ataxia, hallucinations, hypotension, cardiovascular prolapse. And the treatment is galantamine or physiostigmine. Who can remind me of the mechanism of action of galantamine or physiostigmine? Anyone, please, very fast. Mechanism of action of this drug, galantamine or physiostigmine. Guys,
They prevent acetylcholine esterase from breaking down acetylcholine.
yes, that's correct. So it's an indirect cholinergic drugs, indirect cholinergic drug, or an anti-acetylcholine esterase drugs. Okay, so moving on, we have the main anticholinergic drugs here. So we have atropine or scopolamine. So atropine causes mydriasis. Scopolamine can be used for motion sickness. So motion sickness is when you enter a car and you're feeling sick. So scopolamine is going to help prevent this. Also, other drugs is the anti-ulcer drugs. So pyrazipine. So pyrazipine blocks the M1 blockers. Remember, we said the M1 is located in the parietal cell, and parietal cell is responsible for secreting hydrochloric acid. So by blocking this, you're going to decrease the secretion of hydrochloric acid in the stomach. Also, it can be used by asthmatics. So hypertropium and tiotropium is going to cause bronchial dilation. Please take note of this, is a core question. So hypertropium and tiotropium is anti-asthmatic drug and is going to cause bronchial dilation. Also, mydriatics. So tropicinamide causes dilation, so it can be used for eye exam by ophthalmologists. Also, anti-Parkinsonian drugs. So some of the drugs here are benzodiazepine, trihexyphenidyl. Okay, so I just want you to remember the effect of these drugs. So when you see the drugs, you're going to remember the effect and you're going to understand how it works in a question. So cholinergic drugs, so these are the effects. So dumbbell, diaphoresis, urination, meiosis, bradycardia, bronchospasm, emesis, lacrimation, loose stool. And anticholinergic drugs are going to have the opposite. And the main anticholinergic drug is atropine. Okay, so moving on, we're going to move on to the ganglion blocking agents. So these drugs are going to work on the neuromuscular junction, so between the neuron and the skeletal muscles. So mainly these drugs are going to be used when you're going to have surgery. So it's going to cause skeletal muscle relaxation before you have surgery. And there are two types. So we have the non-depolarizing, so they end with curare. So that's why they're called curare-like drugs. And then we have the depolarizing agents. So the way you can differentiate them in krok. So in krok, they're going to say they give a patient this drug and then there was a little contraction before relaxation. So you're going to know it's depolarizing one when there's some contraction before the patient has complete paralysis. So it's depolarizing. But for non-depolarizing, there's no going to be no contraction. It's going to be straight up paralysis. So I want to show you where they work. So this is where the drugs work between the neuron and the muscular junction. So neuromuscular ganglion blockers work here. Okay, so I'm going to give you examples. So remember I talked about the curare drugs. So I want you to just take note of this, tubacurarine. So this is a very popular drug for croc, very very popular. So it's going to be you're going to see tubacurarine or pancuronium or doxycurium or pipecuronium. You see they all have a similar name, so it's easy for you to memorize them and remember them. Then for depolarizing agent, you're going to only tell you one drug. So it's either diethylenum or succinylcholine. Take note, diethylenum is very important for croc. Diethylenum or succinylcholine. So remember we said earlier depolarizing agents are going to cause some contraction before it causes complete paralysis. While the non-depolarizing are not going to cause any contraction at all. Okay, so yeah, so depolarizing block succinylcholine, they causes initial twitching of articulation before it causes paralysis. Okay, so I want you to take note of this point. So it's a very important core question. So succinylcholine is rapidly hydrolyzed by pseudocholine esterase or butyrylcholine esterase. So you can see either of these words in croc, pseudocholine esterase or butyrylcholine esterase. So if a patient is going for surgery and then you inject him with succinylcholine, so there's pseudocholine esterase or butyrylcholine esterase in the blood that is going to break down succinylcholine so that the patient can wake up after 1 hour. But in some patients, there is a genetic deficiency of pseudocholine esterase or butyrylcholine esterase. So the body is unable to break down succinylcholine. So the patient is going to have a state of paralysis for longer than the expected amount of time. So take note, this is a very important question. So when the patient has a deficiency of pseudocholine esterase or butyrylcholine esterase, there's going to be prolonged paralysis lasting hours after the initial paralysis. Okay, so now the indication. So it's mostly used during general anesthesia. So I said that earlier. So it's going to be used to cause paralysis before anesthesia. Okay, so now we have questions. So anyone please read and answer. Please guys, let's hurry up. Anyone can read and answer.
At poisoning by phosphoorganic compound and atropine sulfate was used, what phenomenon is underlying in antidotal action, antagonism?
Yes, that's correct. Okay, next question. Anyone please read and answer.
When copying of instruction to clinic use of atropine sulfate in section Side effects. Student noted tachycardia, increase of blood ocular pressure, temperature rise, reddening. What typical side effect was missed? We have dry mouth.
Yes, that's correct. Good job. Okay, next question. Guys, let's hurry up. Are you shy?
Has accidentally drank a solution that was used by his grandmother for glaucoma treatment. The solution turned out to be kilocarpine hydrocarbide. What drug can be used as an antidote? Is it atropinum?
Yes, that's correct. So pilocarpine is a cholinergic drug, so the treatment is going to be anticholinergic drug, and atropine is an anticholinergic drug. Okay, next question. Somebody please read an answer.
Recommend a patient with glaucoma a preparation from a group of cholinomimetics and pilocarpine
Yes,
hydrochloride.
that's correct. Can we give atropine to a patient that has glaucoma?
No, because it increases intraocular pressure.
Yes, that's correct. Good job. Okay, next question. Anybody please read an answer.
A patient with glaucoma was prescribed pilocarpine hydrochloride to decrease pressure. What pharmacological group does the medicine belong to? Mimetics.
Correct. Good job. Next question. Anyone please read an answer.
Name the drug that causes meiosis and lowers intraocular pressure. A. Pilocarpine hydrochloride.
That's correct. Good job. Okay, next question. Guys, please, let's hurry up.
Patient of 53 years old glaucoma is diagnosed. For treatment, a doctor prescribed anticholinesterase medicine as eye drops. Name this drug. Pilocarpine hydrochloride.
Try again.
Hmm.
So take note of this. This is a key to the question. Anticholinesterase.
So it would end with mine more than likely.
Yeah.
Is
So
this
what?
carbacolin?
No.
No, you said no.
Anticholinesterase drugs. Who can give him an example of anticholinesterase drug?
Neostigmine, physostigmine,
Yes. And
proserine as well.
yeah,
Proserine, that's neostigmine.
yeah. So
Hmm. Thank
proserine
you.
is another name for, I think it's physostigmine. So proserine is also physostigmine. So take note because this can be a tricky question. So because you don't see mean, you might not know the answer, but proserine is also an anticholinesterase drug. Okay, next question. Guys, hmm, anyone can read an answer. Hmm,
What should one prefer to suppress intestinal atony in a post-operative period? Proserine,
yes, that's correct. Good job. So what's atony?
Is it loss of muscle tones?
Yes, that's correct. Okay, next question. Please read an answer. Hmm, guys.
a patient with dry mouth, photophobia, and blurred vision has been delivered to the emergency department. Objectively, the skin is hyperemic, dry, mydriated pupils, and tachycardia are present. He has been diagnosed with belladonna alkaloid intoxication. Which of the drugs should be to given as an antidote? Neostigmine
Yes, that's correct.
or
So take note of, I forgot to tell you about this belladonna alkaloid intoxication. So belladonna alkaloid has the same effect as atropine. So this is basically atropine overdose. And we can see that the symptoms here are the opposite of dumbbells. So we're going to give a cholinergic drug, which is neostigmine, to reverse it. Okay, next question. Guys, should we skip the questions because I'm not happy with your slow response so far? Should we skip the questions?
um an
An
inter
an inter-hospital pharmacy got an order from a surgical department for a depolarizing relaxant for surgical interventions. What drug was ordered? It be A. Diphil A.
Yes. So diethylenum. So what's another name for diethylenum? Anyone please answer. Another name for the drug.
Succinylcholine.
Yes, that's correct. Okay. Next question. Anyone read an answer, please? Guys.
During an operation, a patient got injection of muscle relaxant diethylenium, relaxation of skeletal muscles and inhibition of respiration lasted 2 hours. This condition was caused by absence of the following enzyme in the blood serum: A. Butyrylcholinesterase.
Good job. So what's another name for butyrylcholine esterase?
Pseudocholinesterase.
Yes, take note. This is a very important question for krok. Okay. Okay, someone please answer this.
analeptic remedy of reflective type from the H. cholinomimetic group was given to a patient for restoration of breathing after poisoning with carbon monoxide. What medicine was prescribed to the patient? So it's lobelin
Yes,
hydrochloride.
that's correct. Lobeling hydrochloride. Okay. Okay, someone read an answer. Guys.
Okay. Introduction of a pharmaceutical substance to an experimental animal resulted in reduction of salivation, pupil mydriasis. Next, intravenous introduction of acetylcholine didn't lead to any significant changes of the heart rate. Name this substance. Is it atropine?
Yes, that's correct. Okay. Someone read an answer, please. Guys. Anyone, please read an answer.
Indicate the agent used for treatment of the poisoning of phosphoorganic substance. M. cholinoblocker.
Uh, Try again.
Um,
Wait. Just give me something. You're correct.
yeah,
Yes,
okay.
you're correct. Sorry. Okay, so we're going to be skipping the rest of the questions. So we're moving on to the next topic. So the next topic is adrenergic drugs. So these are sympathomimetics or adrenomimetics. So this is a diagram of the nervous system. So we're going to be focusing on the sympathetic parts and look at where they work on the sweat glands, the cardiac and the smooth muscles, the vascular smooth muscles. So this is where we're going to be focusing on. Okay. So the adrenergic drugs are going to be focusing on the sympathetic nervous system. So we all know the sympathetic nervous system focus on flight or fight. So we can see the effects here. So for the eyes, we have pupillary dilation. So the heart is going to increase heart rates, force, and blood pressure. Okay, so now we're going to talk about the adrenergic receptors. So we have the alpha and the beta. So for the alpha, we have alpha 1 and alpha 2. But for beta, we have beta 1, 2, 3. So take note of the receptors, alpha 1 and alpha 2, and beta 1 to number 3. Okay, so receptors, alpha and beta, alpha 1, alpha 2, and beta, beta 1, 2, 3. So this is the autonomic ganglia. So we can see here that noradrenaline or norepinephrine is released into the synaptic cleft and is going to interact with either alpha or beta receptors. And this is just like acetylcholinesterase, this called COMT. So it's going to break down noradrenaline and it's going to recycle the product. So take note of this. So it's another place that drugs can act on. So COMT is going to break down noradrenaline so the product can be recycled. Okay, so now we're going to talk about the location of the receptors. So alpha 1 is located on the arterioles or veins or internal sphincters or iris dilator muscles. So that's why it causes mydriasis because it works on the iris dilator muscles. Then alpha 2 is located in the presynaptic membrane, the pancreas, the veins. Then beta 1 is located in the heart. Take note, this is very important. Beta 1 is located in the heart, the kidney, or the adipose tissue. While beta 2 is located in the arterioles, the veins, the bronchi. So take note of beta 2 location in the bronchi. So it's important when it comes to the treatment of asthma. So beta 2 is located in the bronchi, the liver, the pancreas, and the uterus. While beta 3 is located in an adipose tissue and the urinary bladder. Please take a picture of this and try to memorize it. It's very important. Okay, moving on. Okay, so now we're going to talk about the action of alpha adrenoreceptors. So it's either going to be alpha 1 or alpha 2. So alpha 1 is located in the arterioles and the vein. So it's going to cause contraction and it's going to cause a rise in blood pressure. So this can be used to treat hypotension. So alpha 1 adrenergic drugs can be used to treat hypotension because it's going to cause contraction and increase the blood pressure. Then for the eye, it's also going to cause decreased aqueous secretion and mydriasis. Then for the GIT, it's going to cause contraction of the sphincters. The bladder is going to cause contraction. The uterus is going to cause contraction. Then it's going to decrease insulin secretion. Then for the male sex organs, it's going to cause ejaculation, then water secretion. So it's very difficult to memorize all of this. But the main marker for krok is this two, the first two. So it's going to cause contraction and increase the blood pressure, and it's going to decrease aqueous secretion and cause mydriasis. So take note of these two effects, is very important. Okay, so moving on, we're going to talk about the beta adrenal receptors. So it's located in the arterioles and the veins and it's going to cause dilation and fall in blood pressure. So it's the opposite of alpha 1. So you can see alpha 1 causes contraction, while beta 2 causes dilation. While beta 1 is located in the heart, it's going to increase the heart rate, the force, and conduction velocity. So this is why when someone is having a heart attack, so you're going to give him adrenaline. So when you give him adrenaline, it's going to have to act on the beta 1 receptors and it's going to increase the heart rate and the force and the conduction velocity. Then beta 2 is located in the lungs. So take note, this is used for treatment of asthma patients. So asthma patients, when they are having an asthmatic attack, there's bronchoconstriction. So this means there's narrowing of the bronchi. So it's difficult for them to breathe. So when you give a drug that acts on beta 2 receptors, it's going to cause bronchodilation. So take note of this. So the eye is going to cause enhanced aqueous secretion. The GIT is going to cause intestinal relaxation. Okay, so the most important thing is beta 2 it causes dilation and fall in BP. So this can be used to treat hypertension. So drugs that act on the beta 2 receptors causes dilation and fall in BP. So it can be used to treat hypertension. Also, beta 1 causes increase in heart rate and force. So it can be used to treat heart failure or anaphylaxis. So anaphylaxis can be used to treat heart failure and anaphylaxis. Also take note of this. It causes bronchodilation, so it can be used to treat asthmatics. Okay. So now we're going to talk about the drugs. So there are two types. So the direct acting or the indirect acting. So the main drugs for the direct acting are going to be the Okay, so the main drugs you're going to take note for here is the noradrenaline. So it's antihypotensive drugs. So these drugs is going to cause contraction of the smooth muscles and going to increase the blood pressure. So it can be used to treat hypotension. Also, eye drops in glaucoma, phenylephrine. So remember we said it's going to decrease aqueous humor secretion. So it can be used to treat glaucoma. So the problem in glaucoma is excess aqueous humor. So eye drops, phenylephrine is going to solve this. It's going to decrease HSU muscle secretion. So the next drug here is dobutamine, dopamine, then selective beta 2, salbutamol, non-selective isop. Take note of this. So this part is very important. So the selective and non-selective. So isoprenolol and just say the prenalines, they are non-selective. So they're going to work on either beta 1 or beta 2. But selective beta 2 are going to work on only beta 2. So take note of the salbutamols, so we call it the OL. So take note of this. The salbutamols are going to work on only beta 2, while non-selective are going to work on either beta 1 or beta 2. Okay, then the indirect acting. So ephedrine is the most important drug here. So the indirect acting are ephedrine. So indirect acting basically means they're going to block the COMT. So they're going to block the COMT from breaking down noradrenaline. So this is indirect acting drugs and it's ephedrine. So this is a very important marker for krok. Insomnia. So in krok, ephedrine is one of the only drugs that can cause insomnia. So if you see insomnia in a patient that is taking a drug, know that the answer can be ephedrine. And earlier we said that ephedrine can also cause tachyphylaxis. So take notes. Okay, so this is basically I want you to take a picture of this and try to memorize it. So this talks about the most important drugs for adrenergic drugs. So try to memorize this or take a picture, whichever one you want. So the direct acting, so we have selective or non-selective, then the mixed, then the indirect acting. So please take note of this. So it's very important. Okay, so now we're moving on to questions. So I want you to take note of this picture. So this picture basically talks about all the effects of adrenergic drugs. So in the heart, it's going to increase the heart rate, the force, the blood pressure. In the eye, it's going to cause pupillary dilation, and the lungs is going to cause bronchodilation. So just take note of all the effects, so you can use it to answer the questions when you see the questions. Okay, so now we're going to move on to the questions part. So please, let's try to just answer like if I say read, just read and answer. There's nothing going to happen to you. Even if you fail, there's nothing wrong in failing. So please let's just try to be fast. So someone please read this and answer.
After beasting as angioedema or Quincke's edema, which drug should be immediately injected to eliminate this condition? I think epinephrine hydrochloride.
Yes, that's correct. So what is going on here is anaphylaxis. So the drug of choice for anaphylaxis is epinephrine or adrenaline. So Kirk is going to use one of the two, epinephrine or adrenaline. Okay, next question. Yes, please someone read an answer.
A
A
patient has
patient,
anaphylactic. Okay.
a patient has anaphylactic shock developed after a vaccination. Name the preparation of choice in such a case. Adrenaline.
Correct. Good job. Thank you for answering fast. Okay, let's continue like that. Someone read an answer. Guys.
Okay. A man
Um,
developed cardiac arrest due to thoracic trauma. Name the drug that should be introduced into the cavity of the left ventricle in case A. No, sorry.
It's correct. You're
Yeah.
correct. It's A. Yeah. Okay, so for cardiac arrest, we give adrenaline. Okay. Next question. Someone please read an answer.
A patient
A
suffering from
patient
allergic
suffering.
Okay, a patient
Mm.
suffering from allergic rhinitis was prescribed ephedrine in form of nasal drop. The patient has significantly benefited from nasal instillation and this stimulated him to use the drug every 2 hours. But under this condition, the drug appeared to be ineffective. What is the most likely cause of the phenomenon? Tachyphylaxis.
That's correct. So, what is the possible side effect of ephedrine use? Anyone can answer.
Insomnia.
Yes, that's correct. Take note of that. It's a crow question. Okay, next question. Guys, last question. Someone read an answer.
A patient with bronchial asthma takes preparation from the group of beta-adrenergic agonists. Name the preparation. It's salbutamol.
Yes, that's correct. So, take note of salbutamol. So, it's for asthmatic patients. Okay, moving on to antiadrenergic drugs. So, these drugs are going to oppose everything you see here is going to be the opposite. So instead of causing pupillary dilation, it's going to cause pupillary constriction. Instead of increasing the heart rate, it's going to decrease the heart rate. Instead of causing bronchodilation, it's going to cause bronchoconstriction. So pharmacology is basically very easy. You just need to understand the terms, then know that the opposite is going to cause reverse of the action. Okay, so first we're going to talk about the beta blockers or the antagonists. So we have the selective, and the non-selective, and then the mixed. So the selective are the laws. Take note. So from the mnemonic I use is from A to M. So acebutolol, atenolol, betaxolol, bisoprolol. So the marker here is LOL. So when you see LOL, you know it's a beta blocker. But you need to memorize which one is selective and which one is non-selective. So take note of this, jot it down, take a picture, whatever. But you have to remember this or memorize it for Krok. So the laws are the beta blocker. So we have the selective and the non-selective. Then the non-selective are the bumpidolol, esmololol, propanolol. Take note, this is very important for Krok. You will see it in your Krok. It comes out every year. Propanolol is a non-selective beta blocker. And why I'm making trying to emphasize on selective and non-selective is because if you give an asthmatic patient a non-selective beta blocker, it can cause bronchoconstriction and the person is going to have an asthmatic attack. So you should never give an asthmatic patient a non-selective beta blocker, or yeah, so it can cause asthmatic attack. So if you give propanolol to an asthmatic patient, it's going to cause bronchoconstriction. Also, we have the mixed, so it works on both beta 1 and beta 2, and also alpha. So it's the carvedilol and the labetalol. So please take note of this, take a picture, try to remember it. Okay, so remember the beta blockers are the LOLs, LOL. That is the mnemonic I used to remember them. Okay, moving on. So the main effects of the beta blockers, they are the antihypertensive, the antiarrhythmic, anti-anginal, and angiolytic effect. So who can tell me the meaning of the word angina? Someone answer first, please.
Constriction of angina pectoris specifically is constriction of vessels within the lungs, like not lungs but chest.
Uh, I don't like your answer.
Mm.
Yeah.
Angina is from the Latin, which means narrow or vessel. So anti-anginal will have a vasodilator effect.
Okay. So basically, angina means chest pain.
Chest pain caused by lack of blood flow or reduced blood flow,
Yeah. So
something
you're
like
talking about the pathophysiology, but angina pectoris usually means chest pain. So that's a layman's definition of angina, chest pain. Okay. Thank you for your answer. Okay, moving on, we have alpha. So we talked about the beta. So beta blockers are the laws. So we have the selective and non-selective and the mixed. So beta blockers are the LOLs. Take note, don't forget. Now we're moving on to the alpha 1 receptor antagonist. So the key drug here is prazosin, or doxazocine. So you see the ending in the same word. So it's easier for you to remember them. That's why I said pharmacology is very easy. You just need to study it a little and try to memorize a little, and you get to your questions correctly. So the main one here is prazosin. That's the main drug, and it is used to treat arterial hypertension. So prazosin is used to treat arterial hypertension. Remember we said earlier that alpha 1 agonist causes contraction of the blood vessels, so it increases the blood pressure. So it can be used to treat hypertension. But alpha 1 receptor antagonist has the opposite. So it causes dilation of blood vessels and reduces the blood pressure. So it can be used to treat arterial hypertension. So that's its prazosin alpha 1 receptor antagonist. Now we're going to talk about alpha 2 receptor antagonist. The main one here is clonidine, and it can also be used to treat arterial hypertension. Remember, we had a question earlier that said a patient took clonidine and alcohol. So, what is the effect of this drug? And it was effect potentiation. So, I don't want you to forget that potentiation. So, if you are taking clonidine and you take alcohol, it's going to have a potentiating effect. So, it's going to cause too much depression of the blood vessel. So, it's going to cause hypotension. So, if you take clonidine and alcohol, so it's going to cause hypotension, severe hypotension. Take note. Okay. Okay, that's all for antiagenic drugs. They are quite easy. Okay, it's time for questions. So anybody please read an answer. Guys, we're almost done.
A patient with essential
Can
hypertension, the drug for non-selective beta-adrenoceptor antagonist was prescribed. Name this preparation.
Okay.
Uh, Prozazine? No.
Try again.
Libatalol, lol, lol, labetalol.
Labetalol.
That's wrong.
Mm, no idea
Prozerin.
then.
Wrong.
What's the answer?
It's A. The
And
answer is A. So I wrote it here, but I didn't draw your attention to it. So propanolol is also called anapriline. So this is how krok can trick you. So propanolol is a non-selective beta blocker, and it's also called anapriline. So in this question, they decided to use an anapriline instead of propanolol. So why the answer is not labetalol? Because labetalol is mixed. So it works on both alpha and beta. So labetalol is mixed. And the question specifically asks you for non-selective beta adrenoreceptor antagonists. So from this, the only correct answer here is anapriline. Do you guys understand?
Yeah.
yes,
Okay, moving on to the next question. Someone read an answer, please, fast.
To a patient with an angina pectoris, metoprolol was prescribed. What pharmacological effect of this depression is used for treatment of angina pectoris? Is it anti-anginal?
Yes, that's correct. Anti-angina, anti-chest pain. It's very easy. Okay, next question. Someone read an answer. Guys.
indicate the state in which non-selective beta-adrenal blocker are contraindicated and bronchial asthma.
That's correct. Good job. So please remember, you don't give non-selective beta adrenal blockers for patients with asthma. Never ever give it. Okay, last question for this part.
Patients with bronchial asthma was taking tablets which caused insomnia, headache, increased blood pressure. What medicine can cause such complication? A. Epidural.
Yes, ephedrine. So insomnia, if you see insomnia, it's a marker for ephedrine. Take notes. Okay, good job, guys. So now we're going to move on to neuroleptics or anxiolytics. So basically, anxiolytics means drugs that help treat anxiety. So when you're anxious, you can take these drugs. It's going to help you treat your anxiety. So we have several types of drugs that helps with you with anxiolytics. So we have psychotropic drugs. So these are drugs that influence your psyche and behavior of patients. So we have neuroleptics. So these are antipsychotics. So we have anxiolytics, anti-anxiety drugs, and mood stabilizers. So this is for those who are bipolar. So they have either mania or yeah. So these are for those who have mania. So mania is when you're hyper, when you cannot sleep and you're hyper and you do so many things, you don't sleep for like 5 days. And then antidepressants, so for people who have depression, and psychostimulants and nootropics, so cognition enhancers. So take note, nootropics are for people who have an accident and then they have mental damage, so they cannot think as well as you and I. So they need a nootropic drug to increase their cognition. Okay, so the first we're going to talk about anxiolytics. So the main drug here you should know for anxiolytic is benzodiazepine. Benzodiazepine. Also, there's buspirone. Then there's The main thing you should know here is benzodiazepine is an anti-anxiety drug. Okay, so the mechanism of action of benzodiazepine is it deals with the gamma aminobutyric acid. So GABA is an neurotransmitter, inhibitory neurotransmitter. So now, I want you to take note of this. So, in the brain areas, there's balance between excitatory and inhibitory. So, if the balance swings in favor of GABA, which is GABA is inhibitory, so it's going to inhibit the CNS. So, this is going to cause sedation, amnesia, muscle relaxation, ataxia. But if there's too little GABA, it's going to cause hyperexcitation. So, take note of this. There has to be balance of GABA in your system. So, too little GABA is going to cause excitation, while too much GABA is going to cause sedation and amnesia. You're going to feel very, very sleepy. So this is why the benzodiazepine deals with GABA. So when you are too hyper, too anxious, so it's going to increase GABA a little so that you can calm down. Okay, so next we have nothing important here. So benzodiazepine. So these are the different drugs you can see in krok. So take note, all of them end with palm. You can see diazepam, lorazepam, nitrazepam. All of them end with palm or lambs. Take note, they either end with lamb or palm. So benzodiazepam is an anti-anxiolytic drugs. Okay. So this doesn't mean benzodiazepam is only used for anxiety. There are other uses of benzodiazepam, but it can be used for anxiety. Okay. So moving on, GABA. So benzodiazepam enhances the effectiveness of GABA by increasing the frequency of the opening of the chloride ions. So you can try to memorize this. Maybe it might come out. So this is the mechanism of action of GABA. So it's going to increase the potency of GABA, which is an inhibitory neuron. So it's going to cause CNS depression. So it's going to make you calm down. So take note of this part. So it's very important. This is going to be in your crock. So benzodiazepam overdose can be treated with flumazenil. So it's an antagonist of the GABA receptor. So if you take too much benzodiazepam, it can be reversed by taking flumazenil. Write it down, memorize it. It's very important for your crock. So benzodiazepam overdose can be treated with flumazenil, and the mechanism of action is antagonism. Take note. Okay, benzodiazepam. So these are the things you can use benzodiazepam for. So it can be as an anxiolytic, hypnotic, anticonvulsant, and a relaxant. Yeah. Okay. So questions. Someone please read an answer, guys.
To the patient who is suffering from a neurosis with anxiety and fear, a doctor prescribed diazepam. What pharmacological effect of preparation allows to use it for treatment of this disease? Anxiety.
Yes, that's correct. Okay. Next question.
And asked to doctor with irritability, restlessness, sensibility. Patient was prescribed 30 medicine from tranquilizers, diazepam,
Yes, that's correct. Okay. Someone read an answer, please.
A patient of 30 has somnopathy and disequilibrium. Psycho-emotional spare was prescribed diazepam. What is the cause of psychosedative effect of the medicine? Activation of the GABA system.
Yes. Okay. Uh. Okay. So moving on. Okay. So the next drugs are antidepressants. So bipolar disorder is a swing between mania and depression. So you have the two sickness alternatively. So sometimes you're manic, while sometimes you're depressive. So manic simply means elevated mood. So you have irritability, disorganized speech, disordered thoughts. So you cannot sleep. So you can stay for 5 days without sleeping. So you might have mania, or you can just be talking anyhow. And then it can swing to depression. So we all know how depression looks like. So you have fatigue, decreased appetite, so decreased libido, and also you have uh yeah, so that's depression. So bipolar disorder swings between mania and depression. So mania is hyperactive, while depression is hypoactive. Okay, so depression. So this is the pathology that has to do with depression. So there are low levels of norepinephrine, serotonin, and depression. So this is the cause of depression. So for us to treat this, we're going to try to increase the level of these neurotransmitters in the body. So we're going to try this following drugs. So we can use monoamine reuptake inhibitors, so the TCAs. This drug is very important for your krok. Nortriptyline or amitriptyline or imipramine. If krok says anything that has to do with depression, this is the answer: amitriptyline. They are going to tell you amitriptyline or TCAs. So they can be used to treat depression. Amitriptyline, imipramine, nortriptyline. Nortriptyline. Memorize this. It's going to be very important for your cock. Also, there are some other drugs that can be used. Selective NRIs, the sectins. So take notes: XETINE. So these are selective SRIs, or the PRAMs, or the means. But the most important drug here is the TCAs, the tricyclic antidepressants, the nortriptyline, the amitriptyline, the imipramine. It's very important for your cock. Also, another mechanism here is the alpha 2 adrenergic blockers, trazodones, the ML. Okay, so memorize this. You're going to see it in your croak. TCAs, nortriptyline, amitriptyline, imipramine. This is the main drug for depression. Okay, so moving on, we have side effect of TCAs. So whenever you hear overdose of TCA, I want you to think of atropine. So it has the same effect as anticholinergic drugs. So think about the opposite of dumbbell. So instead of yeah, so you're going to get dry mouth, blood vision, increased ocular pressure, constipation, urinary retention. So you can see it has all the symptoms as atropine overdose. Everything is the same. So side effect of TCA is like atropine overdose. So it's very easy for you to remember. Okay. So now we have questions. So someone please read and answer. Guys, can
A
anybody read?
patient with a patient with depression has been administered a drug from the group of tricyclic antidepressants. Specify the drug. We have amitriptyline.
That's correct. Next question.
Antidepressant can increase the concentration of catecholamines in the synapses. What is the mechanism of action of this drug? Inhibition of monoamine oxidase.
Yes, that's correct. Okay, so I want you to memorize this. Memorize the mechanism of action of this. So it's going to be very important for you. Okay, next question. Okay, I'm sure.
A doctor administered amitriptyline to a patient with endogenous depression. Explain the mechanism of action of this drug. It is an MA monoamino oxidase inhibitor.
Yes, that's correct. So we can see it here. So monoamine reuptake inhibitors, we have TCAs. So yes, your answer is correct. Okay, so last question. Guys.
Depressions and emotional disorders result from noradrenaline, serotonin, and other biogenic amine deficiency in brain. Concentration of these compounds in synapses can be increased by means of antidepressants that inhibit the activity of the following enzymes. 19C.
Yes.
Yes, that's correct. So monoamine oxidase. So remember this diagram. Where is the diagram? Uh, okay. So remember this diagram. So we can see MAO here. So MAO is going to break down. MA is going to break down adrenaline. So blocking this is going to increase the amount of noradrenaline available. So inhibiting MAO is going to increase noradrenaline availability. Okay. Mm, okay, that's the last question. So now we're going to move to mood stabilizers. So we talked about bipolar. So bipolar is this thing between mania, hypomania, and depression. So manic episodes we have hyperexcitability, while depression we have hypo. So this is very straightforward. The treatment for mania is lithium salts. Memorize this, it's very important for your cock. You're going to see it. Treatment of mania or by treatment of mania is lithium salt. It's very important for your croc. Take notes. Okay. Someone please read an answer. Please be fast.
What group of drugs is used for treatment and prevention of mania as lithium?
Yes, that's correct. Straightforward answer. It's very simple. Okay, now we're going to talk about the nootropic drugs. So these are cognition enhancers. So the main drug here for this is piracetam. Piracetam. So remember this. It's very important for your croc. So piracetam basically enhance learning and memory, increase blah blah blah. So basically, if someone has a craniocerebral trauma, if he has an accident and he hits his head, then when the person wakes up, he has cognitive disability. So he cannot remember well, he cannot learn properly. So you're going to give this drug to help him. So you're going to give paracetam for people with craniocerebral trauma. Okay, so if you and I take this drug, it's not going to have that much effect because we're already okay. But for people with craniocerebral trauma, it's going to help them a lot. Okay, so indication of piracetam. So Alzheimer's, so these people we have dementia, so they are losing their memories. So also mental retardation and learning problems in children. Also curb cerebrovascular accidents to hasten recovery. Okay, so next is question. So someone please read an answer. Can
A
read.
patient, a patient after craniocerebral trauma has been prescribed paracetam. What pharmacological group does the drug belong to? Nootropic agents.
Yes, that's correct. Okay, so next is anti-seizure drugs or anti-epileptic drugs. Okay, before we start, I have a question. So if someone is having a seizure in front of you, what is the first aid? What are you supposed to do if someone is having a seizure in front of you? Anyone please answer.
You can get like a wooden, maybe a wooden, how do I explain it? A
Spoon maybe.
wooden, yeah, spoon. I heard that metal is not so good, so you can use a wooden structure that won't break easily and place in between the teeth to avoid clamping.
Okay, what okay, does anyone have any other answer? Thank you for your answer. Thank you very much. Okay, so does anyone have any other answer?
Can we use diazepam?
What?
Diazepam.
Okay, you're not in the hospital, you're in the hostel and your friend is having a seizure. What are you supposed to do? Guys, I just want to know.
You clear any object that can harm the patient.
Okay, yeah, okay, that's a good answer too. So, any other answers before I tell you the correct answer? No? Okay. So, so someone said you're supposed to put something in between your teeth. So, that is what we learned growing up in Nigeria, but you are not supposed to do that because it's going to be counterproductive. Because someone having a seizure, uh, he's not going to bite his tongue. Nothing's going to happen to him that's going to cause injury in his mouth. So the only thing you're supposed to do is prevent the person from getting injured. So if there are things near him, so just make sure there's nothing in his path, and also try to place the patient on his left side so he doesn't drool on it, he doesn't swallow his vomit or he doesn't choke on his vomit. So your job is to place the patient on the left side and just wait for the seizure to stop. So seizures usually last for less than 5 minutes. So when the person wakes up, you can ask the person if this is his first seizure. So if this is his first seizure, you can call an ambulance and go to the hospital. But if the person is a normal epileptic patient and maybe he forgot to take his drug, so you don't really need to do anything. So basically, for seizures, you don't have to do anything except prevent the person from getting injured. That's the only thing you have to do for a person having a seizure. Okay. So yeah, epilepsy is sudden excessive depolarization of cerebral neurons. So it can be localized. Okay, we all know what epilepsy looks like. So these are the drugs used for epilepsy. So number one is carbamazepine. The next is phenytoin. The next is phenobarbital, ethosuximide, sodium valproate, and also benzodiazepines can be used, and also lamotrigine. So sadly, you have to memorize all these drugs because krok can tell you any one of them and ask you which one are you going to use. And the most important or the most commonly mentioned is sodium valproate, also benzodiazepams. So please try to memorize these drugs. Take a picture, write it down. These are the most important drugs for stopping epilepsy. So please try to memorize these drugs. Okay. Moving on. Mm, no. Okay, so questions. So someone please read an answer. Guys, we're almost done.
An attack generalized tonic-clonic convulsions accompanied by loss of consciousness and general suppression of the CNS developed in a patient after trauma. What drug should be administered? Phenobarbital.
Okay, yes, phenobarbital. So it's also one of these drugs from this list. So you have to memorize this because they can tell you any of this. Okay, so next question. Mm. Someone read an answer. Guys?
Okay, a patient with convulsion was delivered by the ambulance to the hospital, where the diagnosis of status epilepticus indicate the drug of the first choice is diazepam.
Okay, why can't we give phenobarbital? Mm? Why can't we give phenobarbital? Phenobarbital is also an anti-epileptic drug. So why can't we give it here? Anyone? I just want to hear your ideas. Nobody has an answer.
And the patient is already convulsing. So you give the diazepam to relax the muscles first before any other drug.
Okay, yes. So the drug. Okay, wait. Who can tell me the definition of status epilepticus? Anyone? Status epilepticus. What does it mean?
Maybe an unusual seizure. Like you said, seizures are usually I think 5 minutes.
Mm-hmm.
Maybe when it's more or
Mm-hmm.
something.
Okay, yes, you're correct. So basically, status epilepticus is a seizure that lasts for longer than 5 minutes. So when it lasts longer than 5 minutes, then you need to stop it with a drug. And the drug of choice for status epilepticus is diazepam. Take notes, cram it. It's very important. So diazepam. So you might think, oh, phenobarbital is also used to treat epilepsy, so you can give phenobarbital, but it's going to be wrong. So the drug of choice for status epilepticus is diazepam. Okay, next question, guys.
A patient with
A patient
epilepsy
with
and depression
epilepsy.
reaction has been administered a drug that reduced epilepsy manifestation and improved the patient's psychic condition. Is it sodium valproate?
Yes, that's correct. Okay, so this question is kind of tricky because 90% of the drugs here can be used to treat epilepsy. But why sodium biperate is the correct answer is because they said improve patient's psychic condition. So sodium biperate is the only drug here that can improve the patient's psychic condition. Okay, good job. Okay, next we have Parkinson. So the problem with Parkinson is lack of dopamine. So when you have too little dopamine, it causes Parkinson disease. So the treatment is levodopa and carbidopa. So it's two drugs you're going to use it at the same time. So what is levodopa? Levodopa is a dopamine precursor. So when you inject it into the blood, or it forms dopamine. So it's going to cure the deficiency of or little dopamine. Then carbidopa is a drug given to people with Parkinson in order to inhibit the peripheral metabolism of levodopa into dopamine. So in Parkinson, there's lack of dopamine in the central nervous system, the brain, and the spinal cord. So we want to increase the dopamine only in the brain, nowhere else. We don't want to increase dopamine in the peripheral nervous system. We don't want to increase it in the heart, in the GIT, in the blood vessels. So to stop that, we're going to give carbidopa. So you're going to block the peripheral conversion of levodopa into dopamine in the blood vessels. So we know if we have too much dopamine in the blood vessels, it's going to cause unwanted side effects. So levodopa is a dopamine precursor used to increase dopamine in the brain, while carbidopa inhibits the peripheral conversion of levodopa into dopamine in the body. Okay. So question. Anyone please read an answer.
What preparation should be prescribed to treat Parkinson's disease?
Yes, levodopa. Okay. Please memorize this, take notes, write it out. It's very important. Okay, moving on. So we have anti-angina drugs. Earlier we said angina means chest pain. So anti-angina means drugs that are going to stop chest pain. Okay. So now the main drugs for anti-angina is nitrates. So we have sublingual drugs, the nitroglycerin, the azoxide dinitrates, the azoxide mononitrates. So they cause vasodilation. Take note of these drugs: azoxide dinitrate, azoxide mononitrate, nitroglycerin. They cause vasodilation. We also use calcium antagonists, the pins and they are like diltiazepam, diltiazem. So we have the verapamil, the nifedipine, the nimodipine. So calcium antagonists can also cause vasodilation and can be used to treat angina. Also the beta blockers, the LAWs, can be used to treat angina. So they decrease the heart rate, reduce the force of contraction, and lower blood pressure. So take note of these three groups of drugs that can be used to treat angina: the nitrates, the calcium antagonists, and the beta blockers. Okay, so these are the last questions and we are done for today. So someone please read an answer. Guys.
For rapid relief of symptoms of stenocardia, a patient takes nitroglycerin in capsules. What is the most rational route for administration of this preparation? Sublingual.
Yes, that's correct. Okay, next question. Guys, someone please read an answer.
A patient who has ischemic,
Mm-hmm.
a patient who has ischemic heart disease was prescribed a sublingual medication to suppress a stenocardiac attack. Points on this medication: nitroglycerin.
That's correct. Next question.
To the patient suffering on the attacks of cardiac drug from group of nitrates prescribed. Name this preparation: A. Isosorbide mononitrate.
Yes, that's correct. The next question,
I have a
please.
question.
Okay.
Go back to the last question, please.
Mm-hmm.
Okay, so no, go.
This?
No,
This?
yeah, the second question, they said sublingual medications.
Mm-hmm.
I think C is also a sublingual medication, right?
You think C is also a sublingual medication?
Yeah.
Okay. So you see that the question is wrong or you're wrong. So which one is wrong?
So explain. I don't know. That's what I'm asking.
Okay. So yeah, you are right. So both of them are also sublingual medications. So I think the question is wrong. Okay.
What is C used to do? Isosorbide mononitrate.
So it's also nitrates. So all of them are sublingual here. So all of them have the same effect.
I understand.
Okay. So okay. This next question. This uh, guys, two more questions and we're done for today.
After long-term intake of isofovite prevent anginal attack, the patient noticed significant effect on the light. Significant effect of the light. What is the name of this phenomenon? Allergy.
Yes, that's correct. Okay, last question of today. Mhm. Okay, someone please read an answer. Guys, this is the last question.
Indicate the nitroglycerin drug with prolonged action. Is it Sustac?
Yes, the answer is Sustak. So Sustak has a prolonged action effect. Okay, so that's the last slide for today. So does anyone have any questions before we end today's class?
Can you send this presentation to the group?
Okay, I'll do that. Any other questions? Guys, if there's no question, you can send
I
them.
don't think so. No.
Okay, so I thank you very much and have a wonderful day. Good night.
Thank you very much.
Thank you. Good night.